Okay.
Super Soul Sunday. Oh, I'm super excited coming your way. We are live and kicking, and I'm so thankful. Tonight, I'm talking to these three amazing gentlemen doing wonderful things in their community and helping all of us in this pandemic. I have Dr. Jermaine Bamfo, Mr. Richard Isiama, and Kwame Osei. So, gentlemen, you are welcome.
Thank you.
Thank you.
Amissah, Mr. Richard Amissah, I'm sorry. Mr.
Thank you.
Richard Amissah, I apologize. So, doctor, tell the world who Dr. Bamfo is.
Right. So my name is Dr. Jermaine Bamfo. I am a trainee psychiatrist currently working in London for the NHS. So I work with people who have psychoses, depression, anxiety. I do hospital work and community work also.
Right. And Mr. Amissah.
Yes, so my name is Richard Amissah. I live in the east of England in Essex. I work in the mental health team in London, basically Camden and Islington. I'm basically an inpatient staff charge nurse in one of the units. I have worked in Essex for X number of years and I decided to explore in London. I play a leading role in the Harlow community, Ghanaian community. We had an association which I was a chairman of the association for X number of years, and I've been on retirement for somebody to also have a rotational position.
Oh,
So, yeah,
fantastic.
thank you.
Fantastic. Thank you so much. Doctor, I know you're on call, so you're super busy, so we appreciate your time. In this time that we are in, you contracted the COVID virus. So tell me your experience and how you're doing so far.
Yeah, so we've all tried to be careful in terms of wearing PPE and kind of isolating, not coming to work if you need to. But unfortunately, I think it speaks to the new strain that's going about as well. I wasn't so lucky. So I started feeling really fluey, quite exhausted, and then took a test, which was positive, and I had a really rough 2 or 3 days where I was just kind of bedbound, coughing all the time. It's been a couple of weeks since, and I still have issues with kind of exhaustion, and also I get short of breath once in a while as well. So I mean, a lot of people they're thinking about kind of catching COVID and the death rates. But I think another thing that people have to be aware of is the recovery, and a lot of people are having a difficult time recovering. A lot of people, even the first wave, even up to now, they're still having difficulties in terms of exercise tolerance and breathing and all the rest of it. So that's something that hopefully I'll be back to 100% soon. But I think it's something that needs to be spoken about a little bit more and brought to people's awareness.
Wow, we are thankful for the Lord for your life.
Amen.
Every mind matters, and you are a psychiatric. So
Mhm.
tell us when it comes to our minds and our mind well-being in this time. What do you think all of us should do?
Yeah, so I think the first thing is to understand that we are all going through a collective trauma. It's a very unusual time. It's a very traumatic time. It's traumatic in the sense that people have lost jobs or their whole routine has changed. So they're now kind of working from home. They've lost the commute. They've lost that kind of working community. It's affected people's finances. It's affected, kids kind of staying at home from school. And then also the people that have caught the virus, a lot of them have had very traumatic experiences. Some of them have gone to ITU. Some people have unfortunately been bereaved. And then also we're all pretty much under house arrest. So we've gone from having our liberty to do what we want and go where we want and mix with who we want to now having these enforced rules that we have to comply with. So all of those are going to affect all of us to some degree. So I think the things that we have to be mindful of is just, first of all, understanding that and then taking the time to look after our mental health. Because a lot of us can kind of suck it up and be like, this is what it is. Let me try and do the best that we can. But we have to understand that it's a very traumatic time. So keep an eye on your mental health. Create some space during the day, whether it's the first time when you wake up or you have your morning devotion or whatever. Just put some time aside. Just check in with yourself and see how you're doing. Some of the things to be mindful of is sleep. So if you're sleeping too much, or all of a sudden, you're sleeping a lot less than you usually are, that's an alarm bell. Appetite as well. So if you're losing your appetite, that's something to be mindful of. And then, some of the anxiety symptoms, like if all of a sudden you're having heart palpitations, shortness of breath, or if you're starting to have worries that keep on playing again and again in your mind, those are some of the signs that maybe you're not coping as well as you should. And then to address some of those stresses, as well as setting the time to check in with yourself, do the things that make you happy, do the things that help you to relax, whether it's reading, writing, watching TV, listening to music. Even if you found yourself kind of boxed in your house, spending some time going outside, just walking around the block, I think a lot of us really need to put in the work to make sure that we are mentally stable and mentally well, because like I say, it's a traumatic time.
Mr. Amissah, you also contracted the virus, you and your wife. How has recovery been like?
Yes, we had a first batch of the disease last year, March, April. We don't know who actually brought it to the family because we both work in the health sector. So it could be me or it could be her. So we didn't know. Luckily, we all recovered. As the male, I was the person who came out first, and I was trying to support her with food, hydration, and making her happy. Our children, were also there. We have two children, and the girl, as usual, ladies, she was helping us, bringing food to the door, and quickly ran away. She didn't want to contract the virus. The boy hitherto was nonchalant. She didn't want to get involved. She would just make sure that we are okay, and off she'd gone to the kitchen. We made sure that during that period we self-isolated. We inform friends because I'm a bubbly social person. So I used my local platform to inform my local community that I did have the virus. It is real. I've got it. My family, my wife has also got it. Lo and behold, there were a lot of the Ghanaian community within my community who have also had it, but by the myth and the fear surrounding the condition, they were hesitant to let people know. So when I just announced myself that I had it, it was like opening a floodgate, and people started coming. Oh, I also had it. I also had it. So we started just sharing the symptoms. So more or less, we synchronized the symptoms together. And like as the doctor had just enumerated, we had a lot of the symptoms which were common, but some of them may differ based on the individual's ability. My time, we were not very lucky. Those days were stay at home, do not come to the hospital. So we did not even have the facility to go for a test. Anytime we phoned the 111 NHS 11, we were told that stay at home. Getting access to the hospital was like climbing Mountain Everest. So there was no accessibility to that. So we did home remedies, more hydration, and then luckily we were all health and safety. When I declared myself fit and went back to work, what I did was first do the the antibody test. So my work called me. I did my blood antibody test, which came as positive, having shown that I have contracted the virus and get the antibody in my system. Subsequent to that, when the vaccines came, I have gone for my first dose of the vaccine at Whittington Hospital, patiently waiting for my second dose. So that is my experience.
Wow. Dr. Bamfo, when you were young, and we now see, look, we just lost a very prominent young Ghanaian man, who most of us know because we all eat the Uncle John's bread. and we pray for the family, and we say may his soul rest in peace. As a young man in our community, what would you tell the young adults? Because it looks like we thought, okay, it's those who have underlying
Mhm.
health issues and that, but it looks like now that is not the case.
Yeah, so with the first wave, I think they'd got it right in terms of saying that that strain of virus was it was really getting to people who were of older age or who had pre-existing health conditions. And it's unfortunate that that same criteria has kind of rumbled through. So that's what people have in their heads. And I think that's one of the things that has driven maybe young people being a little bit more cavalier in terms of going abroad or mixing with each other still. What we're seeing with these new strains is that's not really longer the case. These new strains are affecting everybody. And if you're looking into the intensive care at the minute, intensive care units, we're seeing people in their 20s, 30s, 40s. A lot of people are saying that, you know, they don't have any pre-existing health conditions. So my advice to young people, especially the young people in our community, is please, 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 please be careful, wear your masks, socially distance, keep yourself safe and keep your family safe, because like we've seen during this week, this virus can catch anybody at any time. And it's almost like playing a game of Russian roulette. You don't want it to be that you catch the virus and you're one of those people who, unfortunately, is not a good outcome. Like I mentioned at the start, a lot of young people, even if they're catching the virus, they're having this long COVID syndrome where they're having long-term difficulties breathing, long-term difficulties in functioning. Some of these people, they have employment, they can't work anymore because they don't have that physical reserve. So they're long-term disabled, basically. And then obviously the worst case scenario is death. So it's really not worth it. All we're being asked to do is wear a mask, keep up our personal sanitization with, you know, hand washing and socially distance, stay at home if we need to. These are all very simple things each and every one of us can do from age 2 to 20 to 80. So please make the effort to keep yourself safe and keep the people around you safe and keep our community safe, because we're seeing that we're being disproportionately affected by this virus, unfortunately.
And you are also a husband and a father. How are you coping with, because I know you on call, and thank you so much. Everybody should thank Doctor for us. He's on call, so he has to take a
Well
quick
done.
break and come and share with us. How is marriage life at home? Because you were gone for a long time, and then you come home. The missus and the kids are very young as well. How are you coping with work? Because you're working long hours and then come home and still be a husband and a father. How is that? How is that affecting
Yeah, I think that the
you?
first thing is that my wife is very understanding. She's been understanding from day one in terms of what
Thank God.
the job entails. So unfortunately, like you're mentioning, in this period of time, the pressures have gone up in terms of the workload. So but she's still been really understanding. I think for me, the main issue is trying to keep my household safe, because I've been on COVID positive wards. I've had to review people on COVID positive wards, and I've got a young baby. So literally, when I come through the door, all my clothes come off. There's a bag at the side of the door. I put all my clothes in, I shower and everything before I even go in and see anybody. And you have to do that religiously, because, like I said, the way that this virus is, especially with these new strains, any sort of kind of gap in terms of your habits and your behavior, it can take advantage of it, and it's not worth it. So I'm trying my best to keep them safe. By the grace of God, they, even when I was ill, they didn't catch it, because I was self-isolating upstairs and they were in another room. Um, but yeah, it's just a case of keeping with all the simple measures. Everything that you can possibly do in your power is worth doing, and you leave the rest to God. But the kids have been fine. Sybil has been amazing. She's more than capable and willing to take up, all the stresses of having the kids at home if I'm not around and stuff. And she knows as well that when I do come home, I put in the work as well. I put in the effort to make sure that I kind of give her peace of mind and her time to relax and whatnot. So it's teamwork. It's been hard, but God is still in control.
God is in control. Thank you so much. What would be your, we are also not, our community also is not very fan of the vaccine. What will be your words? Because I know you have to go. I don't want to keep you.
Yeah, yeah.
I'm keeping to the time.
No, it's all
What
right.
will be your words to everyone who is very skeptical about the vaccine?
Yeah, so I think first of all, I had my first shots on Friday.
And you
And
haven't changed. You're still you, right?
no, I'm still me. I'm not
There's
downloading
no horns
Wi-Fi. I'm
growing,
not
nothing.
nothing like that. So I'm fine. And like Mr. Amissah said, I think he made a very good point about when he started talking to people about his experience. That's when other people started mentioning that they'd had the virus and whatnot. So I think for some reason, people are very kind of skeptical and very kind of anxious about coming forward with things. But I think with the vaccine, people are well within their rights to have issues and concerns, especially in the Black community, because of medical history, which we don't have to get into. So I think those of us who are in the healthcare profession, those of us who have taken the vaccine as well, it's up to us to increase that awareness to be like, look, I've taken the vaccine, I'm fine. We're doing this because we're disproportionately affected. It's safe, and also as well to encourage people to do their homework, but to do their homework in a responsible manner. There's a lot of disinformation that's going on out there, but people really need to take the time to think about where that information is coming from. If someone forwards you something on WhatsApp and there's no author, there's no way of tracking where the origins of that is, there's no point taking that information because anybody could write anything. So we've all got phones, we've all got computers. Take the time to look at websites like fullfact.org, which is an independently run fact website, which is very good at kind of breaking down simply a lot of the misinformation people have had about vaccines, how these vaccines work, etc., etc. But yeah, I think it's well worth taking the vaccine. I've taken it, I'm fine. Mr. Amissah's taken it, he's fine. We really need to take up this scientific breakthrough that's come up to keep ourselves safe and our community safe. So please go and get it. And if you do have concerns and you want to take a little bit of time, feel free, but also put in the work. Ask people who who are of medical background for their insights as well. And ask people who would have that background and that understanding to know more about the vaccine and how it works and etc. And be very careful of the information that you're digesting and where it's coming from before you make a decision.
Thank you so much. So, what are your social media handlers in case somebody wants to ask more questions?
Sure. So on Twitter, I am at Dr. underscore JABZ27, Jabs27. And then Instagram is at Jabs27. So you can find me on either of those.
Wow. Thank you so much and keep
All
up the
right.
great work. And we pray that the good Lord continue to protect you as you save lives. Thank you for your time.
Amen.
Have a
Amen. Look after
wonderful.
yourselves. Take care.
God bless you. God bless you. So yes, doctor has to go back because he's on call, and I really appreciate he had to take time and come. I have Kwame Osei has also joined in. Kwame is a pharmaceutical student and also a mental health advocate. So Kwame will share with us. But let's go back to Mr. Amissah. Mr. Amissah, so you've also worked in vaccines back home in Ghana. So tell us a little bit so that people know that okay, this man really knows what he's talking about.
Yeah, so my background is with communicable disease control, public health in Ghana. I have worked with them for about 7 years to 9 years before I came over to UK. I was involved in eradicating polio out of Africa in 1999, 2000, when we were kicking polio out of Africa, which we used the polio vaccine, which we drop it in children's mouth. We reach every community in Ghana. It is therefore apparent that there is no any community in Ghana which I would not know, except that this community was built maybe 15 to 20 years ago. At some point, we have to foot cross rivers using life jacket, and to reach more people, bicycles to reach people. And thank God, if you went to Ghana now, it is highly unlikely for you to see new cases of poliomyelitis in Ghana. We also use vaccines in eradicating or controlling disease, which we call cerebrospinal meningitis, which is a tropical disease which comes during the hot season period in the north. And it can transcend as far down to south in Accra and Kumasi. We use vaccine we call CSM vaccine to control this disease. Equally, there's also a routine vaccine we use in the public health in Ghana, used by the district public health nurses. First vaccine at birth, we call it BCG, for control of tuberculosis. Children are given BCG at birth. I think we all know that.
So it means that vaccines at one point work, whatever
They
they're
do work.
using to
They do work.
control.
Even
Okay.
in this country, if you came in the health sector and you are working to be employed in the health sector, you have to have an evidence of a visible BCG scar on your shoulder, on your adulthood. If it is not visible, you have to go and do Monto test. You go to occupational health, they give you Monto test before you are employed in the NHS. So
Wow.
it is very important. The vaccine is very important. They work. They have control to help to control tuberculosis in the tropical world. And I've also been involved in controlling tuberculosis and leprosy in Ghana.
Wow. Mr. Amissah has got a lot of apport and a lot to tell us. But let's come to Kwame. Kwame, you are a pharmaceutical student and you have to self-isolate twice. Why? What happened? You went to Ghana and was chilling or what?
So my first isolation was when that was approximately a year ago, when this whole COVID was actually hitting the news wave. So one weekend I was actually experiencing hot temperature. My temperature was increasing. I was actually having flu symptoms, and these symptoms, because it was new in the country, I know that we were still in the winter season whereby anyone can catch flu, but my symptoms were not actually apparent of what I was expecting from flu. So it actually drew my attention and I really got petrified actually experiencing these symptoms after experiencing very well. So I actually drove myself to the hospital and I went to the A&E. So when I went to the A&E, I actually took myself in, and before you go inside, you actually have to do certain tests, even if you are visiting anyone. So I went there and I did the test. So when I did the test, it was confirmed that it was not the COVID. It was rather some
Fear.
kind of viral.
Fear.
No,
You were
it
afraid.
wasn't fear. Yeah, I was. I'll be honest. It was a viral infection I've had previously that is actually resurfacing. So they could actually see that it's a virus infection, but they confirmed that it was not the COVID. But I have to do 7 days self-isolation, which I did the 7 days self-isolation in my accommodation. So when I came back, I also, before the WHO declared that losing your sense of smell and losing your sense of taste is actually one of the symptoms of COVID. I had already experienced it. I felt it very difficult to open up because these symptoms have not been confirmed and I'm experiencing it. So I actually classified it as something is going wrong. So because I work in the pharmacy as a dispensing assistant, someone came over the counter to actually explain to me that these are the symptoms. So I asked the pharmacist about it, and my pharmacist confirmed that this kind of symptoms is actually being experienced by a range of people. So she's not the first person. So that helped me to confirm that, wow, so what I'm experiencing, other people too are experiencing. So I just accepted it. So from conversations, I actually got to hear that other people have actually experienced it. So what happened was later on, I think a month later, then the WHO confirmed that those are also symptoms of COVID. So it made me think that so all this while I was actually showing the symptoms, but it had not been confirmed, because during that time, the WHO has had to do a lot of research. They have to do a lot of studies to be able to come together, to bring together what the symptoms of COVID were like. So it means prior to that, I've already experienced those symptoms, which was declared. And my third isolation, which was even the worst out of it all, it was really mental, because I have to isolate myself for 14 days for traveling to Ghana for family reasons. So I came back and have to observe the 14 days. Thank God, during the 14 days, I never experienced any symptoms of that sort. And prior to that, I've already done my test, and all of them too. Whenever I test negative anyway. So I never actually showed any positive symptoms, but some of the symptoms were actually apparent of it, and it has really kept me on my toes to actually look after myself, and also educate other people and advocate that they need to take it serious, because the virus is not far away from us. It's just circulating in our environment, and we have to take our precautions in order for us to protect ourselves.
Fantastic. And oh, Ferdinand, hi Ferdinand. Ferdinand is saying he had COVID and developed antibodies. It is not an easy thing to joke with at all. Yes,
It's not.
Ferdinand, we so
It's not.
agree. It's something that we have to. But today I'm so privileged that I have two gentlemen who are going to they're sharing their story and also educating us, especially with our mental health. As Mr. Amissah is a psychiatric nurse, a registered psychiatric nurse, and Kwame, you do really, I know you really, really advocate for mental health in our communities. You know, now Dr. Jermaine, who just shared with us, also said it's like most of us are under house arrest.
Yeah.
And so we're not going anywhere. Our home, last week, I did say that now our homes, our school, personally, thankfully, I mean, we have a bigger place. So I have 4 kids. So they have taken all the rooms and changed it to their classrooms. And when they would, because I work from home, and when they will have to go to school and I have some peace and quiet to do my stuff and be on the phone and talk as loud as I can, now I cannot, because I'm tiptoeing. And there's like, mommy, I'm on Zoom class. Mommy, so I'm carrying my laptop and, but some families haven't got that privilege. And so it's difficult and it's taking a toll on them. Mr. Amissah, what would you say to such a family that are really struggling?
Yes, it is very, very true that the toll of the pandemic and the lockdown, the first, second, and third lockdown, is going to have a very serious impact on the mental health of the citizens of the world. Basically, I wouldn't say this country. It's basically a pandemic, and it's therefore affecting every corner of the world. Coming home, let's talk about we people in the UK. More especially we, the people in the front line, the nurses, the doctors, and the shopkeepers, the train drivers, the transport, and most especially the Black and ethnic communities who are more working in the front line jobs. We are seriously affected by this pandemic, and we are going to have the impact of this pandemic on our mental health for now and the foreseeable future. At the end, it looks like we are sitting, or we are seeing the tip of the iceberg. The massive chunk of the problem will come after the impact of after the pandemic has been controlled, where we will have a replicate of the mental health condition will surface. Children in school, people who are working. If I should give you some figures, there's some figures to share that about 241,600 health workers are currently feeling the impact of the pandemic and the lockdown and the stresses of the epidemic due to the constant and the daily exposure to the people they see in their workplaces, i.e. through death, i.e. through breaking of bad news to families. So a lot of people are experiencing post-traumatic stress disorder. People are having anxiety and depressive disorders as a result of this problem. So the problem is there. It's going to affect us, and we have to take it serious. The way to control it, we will discuss this as the discussion goes on.
Kwame, you are a student, and I know the first pandemic, that was when some you in the you in your final year, are you?
Yeah, I'm in my final year.
So, and as a pharmaceutical student, I know you've got to really study hard. But
Yeah.
then, how has this lockdown, this pandemic affected your studies?
It has really had a big toll on my studies, I'll be honest, because I'm not the kind of person who is actually used to studying in my room or in a smaller environment. I prefer a bigger environment like the library. So everybody who actually knows me well knows that the library is a place that I don't actually joke with. But one of the places that were actually had to close down because of the spread of this virus was the library. So I had to actually readjust myself to using smaller environments to study. So it really had a big impact because I'm stuck in the same environment that I used to study, to sit in the same environment to do all my examinations, which was not an easy way to actually go about with it. So it's a way of me had to actually readjust myself and actually put myself in the environment. But thank God that this during this lockdown, the library has not been affected. It's actually open for a certain number of hours, which I can use to utilize it to actually to my advantage, which I believe other students, because I'm actually based on campus, I'm able to access the library easily. But those who don't live on campus and stay at home, I believe that it's still having a toll on them. So it really had a very big impact, which we had to actually live with it and readjust. At the end of the day, we have to actually live and adjust ourselves within the new norm of living in an environment, because if we don't do that, it's also going to have other impact because the COVID or the virus that we're experiencing hasn't shown any signs that it's leaving our environment anytime soon. With the rising numbers, with the new variants, which is actually coming on board, it's really devastating. So as a student, it's really affected me, but I'm just grateful that it had not actually impeded on the progress of our studies. We are still carrying on studies through different mediums, and the necessary help is available for us. And if you have got a group of students you study with, at the end of the day, you still can experience it, but through other social media channels like the Zooms and the Microsoft Teams. So one way or another, it has affected me. But as time goes on, we've managed to figure out how we can step out of this kind of cloud that we are under in order for us to actually get a better outcome of our studies.
Fantastic. There's this I also want to share how to improve your studies, which my wonderful husband, because most organizations are also helping their staff. They are helping those that have been furloughed as much as those who still have to go to work. And he said, this I want to share, and also, I hope it will be a blessing. It says improving your mental health during the pandemic. Stay connected. So you've got to stay connected to people, your friends, not the negative ones. The environment, all that is going on is too negative for you to be staying connected with negative people.
Yeah.
So please stay connected to people that will empower you, people that will inspire you, people that will encourage you, and recently somebody sent me a post that came from their leader because they're not attending church. And it was so sad that in this pandemic that we are, people are bitter because people are not attending church, or people are not attending certain meetings, wanting people to come out of their house to, and it's sad. So if you're a leader out there and you're listening to us, please think of the lives of people. I believe that we are all believers. Now I'm talking to, spiritual leaders. I know that we pray. I know that, but when people decide to make decisions for themselves and decisions for their families, don't take it personal and start sending negative things and start using your platform to barge people because they are not coming. This is the time that we need to shield our people and pray for our people, but you cannot bash people and pray for them at the same time. I don't see how that works. So, this is the time that we've got to show love. Love is the best medicine in the world. And when somebody is down and you show love, it uplifts your spirit. But when somebody is drowning and I had to be very nice and polite not to share certain things on Facebook because I think that sometimes we have to apply wisdom. But if all this information got into the hands of, we have some interesting bloggers and journalists out there that will just come and rant. And Mr. Miss, I believe you saw the man of God that was praying to kill journalists because they put some certain things together.
Yes.
The Nana Church show don't do that. So we apply wisdom to certain things. But I pray that people would understand in this time not to bash people, but to uplift spirit. It also says that keep active. Simple walks like we are allowed to go to for exercise and get a skipping rope. You can skip. If you have a garden, run around in your garden and stuff like that. Consider activities that reduces anxiety, yoga, meditation. I mean, I am a Christian, so I'll say pray. Learn how to pray. If you don't pray, put on some praise music, put on some worship songs and pray. It says if you're working from home or you fellowed, try and keep to your daily routine, the time you wake up and the time you go to bed, as Dr. Bamfo shared with us. Don't sleep too much, else you put on weight, and don't eat too much. Don't cut down on the fufu. You know, and it says eat a balanced diet. So eating well, your fruits, your vegetables, and all that is very important. Learn new skills. I mean, this pandemic has made people, those who thought they couldn't bake, people are baking, people are cooking, people are doing creative stuff. So do that. Manage how you follow the outbreak and try to avoid speculation as we talking. This is something that they are given to their employees. So if you're a leader out there, these are some of the things that you're supposed to show your congregation or your followers, not bash them. So don't bash people. So Dr. Amissah, let's come back to you. And I think Ferdinand has also
Mr.
shared
Amissah.
something.
Sorry.
Yes, you're a doctor. You're a doctor.
Mr. Amissah.
Mr. Amissah. So, let's talk about the vaccine again. Let's come back to in how have you been able to tell our people to research and go for the vaccine?
Yeah, so I do have a lot of WhatsApp groups, and the first time I had my vaccine, I had to publish mine online for people to see. Equally, I've had some nurses who have had their vaccines and they've taken photos during the shot after and subsequent days after the vaccines, and have publicized their photos on WhatsApp for people to see that they are alive, they are not dead, and they are ongoing, carrying out their normal day-to-day activities. I took my vaccine, and the first day, the second day, I went to work. Even the day I had my vaccine, I went from work to have the vaccine and back to work. I didn't have any side effect, no pain, no fever, no headache. Everything went smoothly. Somebody will say because you are an active person. No, yes, I am an active person, and I'm also very honest with myself that I'm not going to concoct any side effect which is actually not there. If I've never experienced the side effect, I'm not going to say it. We have done a lot of field jobs where we have given people medication where placebos are involved, and people are mimicking, people who even are in the placebo group are mimicking the side effect of the people who took the actual medication, because people are saying they had it, they had this, they also copied the same information and are saying it. Like you said, people, the Dr. Bamfo said, people are using unsolicited WhatsApp information of people who are not researchers, because we are believing that the thing is coming for information is coming from the internet, so it is relevant. That is not true. The information has to be researched, has to be peer reviewed, and should have basis and evidence. Any doctor, you could be a doctor, stand in the corner and you make a video anti-vaccine. It has not been solicited, it has not been confirmed, it has not been proven by second opinion doctors. So why can I rely on such information? So we have to be careful about this. On the local front in my area, luckily we have a local church in here, which last Sunday I was told, apparently I was told that the church has organized some health personnel to come and educate them on the relevance, on the uptake of the vaccine. When I heard this information, I was very impressed and I was very happy in my spirit that for once, some of my people are also trying to rationalize the need and the importance of accepting the vaccine. That on the public health aspect of it is that this vaccine, taking vaccination is normally, we don't actually experience 100% coverage. Obviously, we know that some people might be having underlying health conditions that they will not be able to accept the vaccine. So this vaccine, we are aiming around 85 to 100%, which we normally call the herd immunity. So if we are able to hit 80 to 85% of the total coverage of our expected population, it means the rest of the population who will be in between are not able to accept the vaccine will be covered. It is therefore important that we hammer home and encourage ourselves to get the vaccine so that we could protect the vulnerable people who will not be receiving the vaccine for one reason or the other. So at my local front, I'm doing the best by informing people always on the WhatsApp, on the internet, communicating as far as to Ghana All Students Association. I attended Asankagwa Secondary School in the Western region where I did my sixth form, and I've been able to help mobilize ourselves, always communicating to them, giving them update of number of death in UK as compared to number of death in Ghana, always trying to tell them about the new variant of the virus. That the new variant is more virulent than the first one that we have. Virulent in the sense that when you get it, the propensity for you to die is very high. So people should be careful. And we are lucky here, a vaccine has come. It is important that we accept this vaccine and take it to protect ourselves and our loved ones.
Mr. Amissah, I've just got a text from someone that says, what would you say to undocumented migrants who are scared to come forward when experiencing the symptoms of COVID-19?
Okay, migrants who are scared.
Undocumented, so let's say illegal immigrants.
Yeah, they don't have GPs to come out for. With the vaccine, so long as you have NHS number, you can come and have it. Or when we go for the vaccine, all they need is your address and NHS number. For
No,
now,
no, he's saying they're scared to come out because they might be experiencing the symptoms, or some people might even have it, but then they're scared to come out because maybe they would they still, let's say maybe he's trying to ask, if they come out and say it, will they deport them? What's going to happen at the moment?
Yeah, at the moment, I can answer that because I'm not an immigration officer, but I think it's important. It's important that they come out and get help, because you can die in your room.
Yeah, you can definitely die in your room. So I believe that, I mean, the wise thing to do if you don't want to die is to tell somebody, say
Yes,
something. There are people out there. They are let me I have this. There is the Samaritans that you can go online and check them out. There is Mind, there
mind.
is
Yes,
Calm. I like the Calm. It says campaign against living miserably, and there are lines for national domestic help, domestic abuse helpline.
line.
There is Hub of Hope app. So, and then there is also Every Mind Matters. So there are supports out there that you can go online. They have their numbers on there that they can help. And as Dr. I think I'm giving you the doctor title.
Yeah,
Mr. Amissah,
Mr. Amissah.
when we finish, you can inbox him and ask more questions. If you want more questions, you can send me questions and I'll throw it to the appropriate people, because this conversation had to follow on because of what we did last week. And so Kwame is also a health advocate. You can also inbox him, and there are a lot of people. That there's one gentleman that I will bring on, Ferdinand, who also work in the health industry, and then he can share. But before I bring him in, Kwame, so I told Dr. Bamfo that we've lost a very prominent young man in the Ghanaian community, and we know that in December a lot of people went back home partying, visiting, chilling, and are coming back. Some are coming back, some are shielding, some are not shielding, some have just find themselves in society again. What would you say to young
What
adults?
Yeah, what I would say is, like, even let me start from coming from the from like Ghana. Because I went there for family reasons, I actually made sure I had to take good care of myself, because I knew that the virus is actually out there. It's scary. So I didn't actually put myself on the risk of going out there as much, because I knew the specific purpose why I actually went there. But that did not actually restrict me. All what I did was I had to put all the necessary measures to actually follow the protocol, both in the country and outside the country as well. So when I came, I observed my 14 days, which I made it known to my institution, my workplace, my university. I made them aware that the NHS have told me to isolate for 14 days, which I observed this. So I would encourage anyone who has been told to isolate. It's important. You don't need to actually cut your way around, because if you do it and unknowingly you are actually asymptomatic, you could actually end up actually spreading the virus to other people who actually could be detrimentally affected. So please, let's observe our isolations when we've been told to by the appropriate health workers or appropriate health professionals, to actually ensure that our life and other people's lives are safe from this virus. And I will also, which I've always been doing, to educate, especially educate people who are very skeptical about the existence of this virus in our society. I've been educating them and encouraging them that you have to wear the mask. It's really important that you wear it. So it's not about the government telling you what to do. It's also about you making sure you take good care of of yourself, because the virus is actually out there. It's live. And to our young people, to our young adults, I will advise every single person is that this virus does not know age. Is killing people. It's literally killing people. And if it hasn't got closer to people around you, don't imagine that it doesn't exist. Because this week it has really hit me so hard when I heard about the demise of Sam, and also someone closer to me who shared with me about the experiences. I encourage the person to go and take the test. If you go take the test and you are testing positive, you have to actually observe all the necessary protocol to make sure that you and the other people around you are safe. And the person actually followed suit. They actually got all the necessary multivitamins and the complementary medicines like the herbs and or the herbs that they can drink, which is the sobolo that they can drink. They actually followed suit, and the person is recovering very well, which I've seen it myself, that the person is recovering very well. So I would advise our young adults that please, no one is exempt from this virus. Let's all protect ourselves. It's real, it's killing people, and we don't want to lose any more people. We just have to make sure that we protect ourselves and not put our family and other young people or our friends at risk as well. So that is the message I've got for young people.
Fantastic, fantastic. Thank you so much. What about the children? What about the youth? Because most of them have been at home for a long, long time. I have four of them. Thankfully, we're hands on. But some parents have to go to work, and
Yeah.
some of the kids have to stay at home homeschooling. And we give shout out to all the teachers out there. I mean, if you're a parent homeschooling, now you know how the teachers are doing at school when the kids have to leave home at 8:45 and come home at 3:15. So we really applaud our teachers as
Yeah.
much as all the essential workers out there. You are doing fantastic. What should we do with the kids apart from um, their homeschooling, Mr.
I would
Emisa?
say that, yeah, I would, oh,
Mr. Emisa, go first, and then Kwame would.
Yes. So, as from a mental point of view, when the children are at home, one children they feel bored at home. They should have been in school to socialize, to get education, to actually develop themselves, and to be of friendship. This coming home and staying in within the four walls of the family room, a family house, you are lucky. More, maybe your income is good. You are able to access a laptop per every child or any form of electrical gadget per child. What about families where four children have to share a single laptop? It's very difficult. What about a family where they have not even got a common backyard garden, where children have to cram in the same room 24/7? The only place they can maneuver is through the living room, bedroom to the kitchen. It's very stressful, and this can lead to a depressive or stressed mental state. So it is very important as families and mothers, parents to watch what the children do, how they sleep, behavior disorders, how they get up in the morning, are they following their routine equally, if they are even following out the school lessons online. Some of them could sleep from then during the day, whilst in the night, they will be on the internet chatting with their friends. Parents have to monitor all these things to be careful that this is not happening, and children are getting what they need. Equally, the importance of access to fresh air is very paramount. The mental state is well maintained and balanced when you have fresh air, and we know this disease goes lying in line with oxygen deprivation when you cannot breathe. It is therefore important that children and families get fresh air. Very unfortunate for some of us with the black and minorities. Some of us are mostly in the low income group. Subsequently, we are in the bottom of the housing ladder. Subsequently, we are in the deprived areas, and therefore our housing is very poor. We have a low income, and therefore accessibility to fanciful and accessible good housing is a problem. It is therefore very important that we maintain the balance and look after the children. Networking is very important, as Dr. Bamfo said earlier. We have to get on with friends, but as Nana said, good friends equally is very important. Monitor who your children are linking to is very important. Another important area is when the children are home and when people cannot go out. We have families where there is abuse, family abuse and child abuse going on. During the first pandemic and the lockdown, the police had an increased exacerbation of reported cases of abuse as a result of domestic violence. It is also very important that we monitor this. Drug use and alcoholism is also increased around this period when people are home. People take into comfort eating or comfort drinking. They take solace in a bottle, thinking that their depressive mood is going to go away. I was telling my friends this afternoon that personally, I myself, I feel depressed because I'm not naturally a confined person. I'm always out there, doing something out there, doing something different, visiting. Therefore, confining myself in a room 24/7 has made me somehow depressed. However, I am not clinically depressed.
Sure.
Don't get me wrong. I am socially depressed because I can't go out.
Because we can't go out, we can't do anything.
Yes.
Yeah.
And like you. So it is important as families we monitor. Still, we can link with our close friends and family links on the phone, where there's the need for us to meet in the park area, social distance protocol in place. We can meet in a park area and have a chat, meet people, and then get fresh air and come back. Exercising, as has been enumerated. So
it's very important. Very important. I want to add to what Mr. Amissah says. We have to also listen to our children. As an African parent, sometimes they need your attention, and make time for them. Listen to them when they're finished with their works. Try do some games with them so that it would take their mind off certain things. Support them. Let's get involved. This is the time that because most of us before the pandemic, we don't have time for the children, or it's not that we're working. You're gone in the morning, come in the evening, same 365 days. So this is the time to get to know your child and your spouse. So we will come to the spouse. Mr. Emisa, how he's able to, even though he's not depressed, how he's keeping it alive with the missus at home. Kwame, you have younger brothers as well. How is it going at home?
At home, they actually join with them. They are not at home. They are actually back in school because of my mom's job that she's actually a frontline worker.
Oh, so they get to go to
school. They get to go to school from Monday to Friday.
Oh, wow.
Hours. They get the teachers to support the children of frontline workers. So my mom actually gets that support. She opted for it because if my brothers are staying at home, they wouldn't actually get their studies.
They will finish each other.
As you already know, they will actually not get studies done. So when they go to school and they come back home, they're able to also get some of their activities done. Like they get to relax, they get to actually play. But we have to actually balance, as Mr. Amissah said, they have to be a striking balance between what their kids actually do. Because if they're in their normal routine, they would not feel bored. They are actually out there doing their normal schoolwork. And when they come home, they're able to also get their relaxation and also join in with their social group, because at church, they have also got a social group whereby they meet on Sundays through Zoom. They also got their own tutors, which they actually communicate with them through Zoom as well. And they've got other activities that they play normally. So they sometimes feel bored when the schools are actually closed. They complain, I'm bored, I'm this. But with all these in place, they are able to manage it and actually keep it going. So that is one of the ways that my parents actually support them to actually make them.
Wonderful. I want to read what Abby, thank you so much. Abby Love says, this is life and death matter. So I'm sure immigration officers will not be heartless in this pandemic. Your life first. So I would personally say go and seek for the help that you need. I know it's easy said than
Very
done,
important.
but it's not worth it losing your life over papers, and it will be very shallow for any health worker to call immigration on anyone. Just saying, hashtag human rights, so I am not an immigrant, so I'm not going to, but what I can say is that, go online. There's so many. I did read out some, I will read them out again. The Samaritans, Mind, Calm, National Domestic Abuse Helpline, Hub of Hope app, Every Mind Matters. These are organizations out there that are really, really supporting people in this uncertain times. If you go to church, you can talk to your pastor or somebody that you think you can confide in, and so that you get the help that you need. There are people out there that are giving information. There are good platforms out there that are giving information, but I would say that stay away from those that would add more. My Nigerian people will say wahala. You don't need any wahala in this uncertain times that we're in. Mr. Amissah, you and your missus got it by the grace of God, caught the virus by the grace of God. You have recovered, but how are things at home? Is she also working, or she's a stay-at-home mom? What does she do?
Yeah, so what I say, fortunately or unfortunately for us, we both have to see people on a daily basis. We are not in the category of people who work from home. Unluckily for us, I'm a frontline worker. I see people daily, and I like to see my patients, and I care for them. Because of the virus, anytime we went to work, any new patient coming in, we have to screen them by taking a COVID swab from them, and we isolate them for 7 days in their rooms until the result comes negative before they can come out to integrate within the immediate community. And then every week we have to re-swap every patient on the ward and take it to the lab for the result. If we get 1 or 2 positive out of about 16 people, the whole unit is closed down and declared as an infectious unit.
Oh wow!
Yeah, so we are daily, like the Dr. Bamfo said, we are daily exposing ourselves into it. We are daily in contact with new persons, and we are also seeing influx of people from the community who hitherto have not experienced mental health services because of the lockdown and its associated mental health, anxiety, depression, and post-traumatic stress disorders. So I am always into it. Having said that, it has improved my experience with COVID. It has improved my swab taking skills, my knowledge and ability, and my competency to handle and understanding of this disease. And having also had the opportunity to take my first jab, it is my responsibility to tell my community to date. My wife has also had her first job. My wife works with the GP services, so she has to go in to see her patients as well. Most of the time at the unit, she calls people on the phone. However, there are certain patients she has to see on a one-to-one basis. So she calls them in, examine them, take samples, and so on. So we are on the negative side. However, one we did we tested, we had the disease, we tested antibody positive, and then we are still protecting ourselves by going for the jab. We hope. We also do lateral flow test. Anybody working with NHS and seeing patients on the face-to-face, we have been given home sample kits, which we test ourselves twice in a week. And then we report online to our NHS service. If you test positive, you phone your manager to say that my lateral flow test at home, though it's not very conclusive, it's about 50-50 percentage surety. Then you go for a proper test in a hospital to guide, to confirm that what you've done. So there are checks and balances in place so that we don't get ourselves infected, and then we also don't infect our patients.
Wow, it's a lot to take in, but we are winning. We are thriving, and thank you so much for sharing with us this evening. It's something that has affected each and every one of us, and is taking a toll on people and on families, on spouses, on organizations. You know, people are losing their jobs, as we've all shared, but there is one thing that if you stick together and you communicate, communication is very important in this time that we are in. If you're feeling so overwhelmed, there are people who you can talk to, people that you can go to, that can help you in this time. Kwame, you're back in uni, you're still studying. How what about your colleagues? I know you're not supposed to, now we social distancing and all that. Has this affected some of your friends as well?
Yeah, it has, because every time we get together, because we do group study. So every time we get together, everybody get to actually share their experience as well. Most people are not within the natural environment of their studies. Like some of them have to actually move from university accommodation to actually stay at home because of the uncertainty about this COVID. So instead of paying for rent, they are rather staying at home to actually do the work with their families, around their family. So most of them are actually complaining that they wish that they could have actually moved back to their university campus, but they made the decision to actually stay at home. So I would say that basically all of us are actually being affected by this one way or another, which one of my colleagues actually reported about his one of the people he stays in the house with, whereby he tested positive. So he has to self-isolate because he's in the same environment with such a person, which the university actually accepted because the uni has actually opened up for us to report to them whenever we feel like we are having symptoms, if we have actually tested positive or people around us are actually testing positive, which could possibly have an effect on every student's studies. So such support has been put together to support students as well. So yeah.
Wow, students. It's very important as well. I know that my son, he's in year six. His headmistress calls. They check in twice in a week. His teacher also calls, and I hope they do it to other parents. When you listen to radio shows and in the week, you see that teachers calling and talking to students and peoples and all that. So I think each and every one of us should do our bit. But the most important thing that we all have to do, obviously, is to wear our masks, wash our hands, sanitize, the social distancing. And I believe that at this point in time, all of us have gained something to say that, look, we've got to protect each other. If you haven't gotten to that point that you think this thing is still a hoax, maybe you take a trip to the hospital and join Mr. Amissah and see what people are going through, or take a trip to the morgue and see people who have lost their lives because of this. So please, may we not take this as a joke anymore. You know, I know that I come back to say I'm a Christian, so I always come back to say we pray, but after praying, you apply wisdom. We pray after praying, you take care of yourself. We pray after praying, you look out for somebody else. It is so important. We are in a doctor said, you know, it's making people, and in a way, is also bringing out the characters of people because people are really angry. It feels like we are in a war.
Mm.
Mr. Amissah, am I right?
You are right. Yes, you are right.
I'm right. It feels like we're in a war because people are angry. Some people are angry for no reason. So if you're one of those people who are angry for no reason, please, may the good Lord have mercy upon all of us. But let us sit back. Let us reflect. I'm just waiting for one more person who wants to share with us, and then we will finish our conversation. That is what I'm trying to get him to come on. And Kwame, what would you say to all of us as we round up?
What I would say, my message I will leave for everyone is that we are still battling this. I know lots of people are asking a lot of questions. Is it going to affect my summer? I want to do this. I want to do that. I always tell people that, you know, in one way or another, let's just accept that we are all fighting this. If this was only affecting only a community or a group of people, we would have said that it's actually a disadvantage. But right now, the disadvantage falls on all of us. The moment we want to actually try to actually break the protocol to leave the normalcy, that's the moment we actually extend the lifespan of this virus within our community. We all want this virus to leave our community. Hopefully by the end of this year, there will be low numbers coming out. But if we are not abiding to the protocol whereby people are not wearing masks, people are actually breaking the lockdown rules and everything, it could actually make and extend the lifespan of this virus within our community. So I would say that let's just accept this. Let's all work together and ensure that we don't put people at risk. You know, because if you're going out just for social purposes, but it's not very urgent or very important, you are basically being selfish on those who are actually observing the protocol. Because me personally, I have to work, so you only see me coming out if I'm actually going to work or I'm going to the library. Those are the only times you see me coming out. I wouldn't actually say that, oh, today I'm feeling bored within my room, so let me just go and visit this person. That wouldn't be fair on other people at all. So we have to make sure that one way or another we are observing the lockdown. And one thing I'll also add on to is because staying within the same environment is not our natural confinement as human beings. So if you're experiencing any form of difficulties, i.e., your mental health is being affected, the possible group that Nana actually put online, which is the Samaritan, the Calms, make sure that you get in touch with them to make sure that you explain. If you're experiencing anything not normal, call the NHS 111, explain to them. Maybe you might be actually making it blow out of proportion, but it's important to get help when you feel like something is not going well as soon as possible. Stay in touch with your friends, your families, let them know how you are actually experiencing. You know, doing those kind of stuff will help to put you at ease. If I feel, especially for students, we are in this situation because me personally, in my final year, which at the moment I've got a lot of assignments. I've got my dissertation. One way that I use to actually make sure that I don't put a lot of pressure on myself to make me feel like I'm not doing the work is to exchange ideas with my friends. How are they getting on? Which stage are they at? Having this conversation gives me that kind of morale and the motivation to push myself to move on, because I may think that I'm actually slacking, but meanwhile there might be someone else out there who even wish that they are at the position I'm in right now with the level of work I'm doing. Exchanging those kind of stuff, it helps each other to motivate each other, because the person is looking at me that I'm moving on, and I can help the person to also join me on board on how they can improve as well. So staying in touch with our family and friends is really important. And as students as well, if anything is not going well, don't hesitate to get in touch with your institution let them be aware, because at this point in time, if your university have not taken into consideration of how students could be supported, then there's a question mark out there, because my university has actually come out here and making known to us how they could support us, i.e. our exams, i.e. Events at home, because no one actually planned this to happen. So if this COVID situation or this COVID pandemic is affecting your studies, you need to get in touch. Don't fight it on your own, because if you leave it too late and it reflects on your grades, the university might not be able to help you at that particular point in time. So I would say stay in touch with the institution as well. With that way, there's a collective help around you, especially me being my final year. Itself is stressful, but for these external factors to also pull me down is actually unfair. So I keep in touch with people and actually be open to them to see how they can support me, how my work could be supported. So those are the words that I can support. I'll give to everyone. And I would say with us, the frontline worker, because I'm a frontline worker as well. Every Saturday you see me at the frontline, or during the week you see me helping patients as well. Let's keep going. Let's support our community as much as we can. Even if no one is seeing our hard work, God is going to reward us. The community sees what we can do. We can physically see that most of the people who come to seek our help during this pandemic are still alive and they are kicking as well. So that alone is a reward to us. So let's keep going. And hopefully at the end of this pandemic, we can reflect and see how we actually made history to be able to save other people within our community, and how we have been able to thrive and strive to make sure that this.
Oh, right. Kwame, thank you so much. Mr. Amissah, what would you add to what Kwame has said? Your final words.
Yes, so my final words are 1, 2, the vaccine has come to actually save the situation, and it has come timely, though delayed. It has come at an appropriate time, and we have to accept it. Before I end up, I just want to give you a statistical figures about during the first wave of the pandemic and the effect of NHS staff who were in the front line of the pandemic. It was estimated that over 200,000 health workers from the NHS suffered some form of mental illness during the first wave, and the breakdown is as follows. 36,996 health staff workers suffered post-traumatic stress disorder. 36,996 suffered post-traumatic stress disorder. Another 120,372 have high psychological disorders in various forms, i.e. depression and anxiety and panic disorders. So those are the group.
Wow.
Another 81,499 health workers suffered burnt out. And when I say burnt out, the nurses, you understand, and the health workers, people get to a point that they cannot carry on anymore. Yeah. They hit the bottom line. So even from March to September last year, this is the statistical figures we are having on the impact of COVID on only a cross section of the health workers. Coming back to the other frontline workers, bus drivers, shop assistants, home care workers, care homes. So that the figures is very massive, and it is expected that over 10 million adults are going to suffer. If you extrapolate the number of children who are going to also have mental health disorders of one way or the other, it is also extrapolated that about 5.5 million children in this country are going to have mental health disorders. And these figures are going to be more than I have even mentioned, because we are not seeing light at the end of the tunnel at the moment, unless we all concerted effort to uptake the vaccine. Thank you.
Thank you so much, Mr. Richard Amissah, who is a registered psychiatric nurse. Thank you so much for your time. And Kwame, thank you so much. And also to Dr. Jermaine Bamfo, who started the program with us, but he's on call, so he had to leave. I'm my guests, all my guests this season are busy people, but they've all make time to squeeze in, and I'm so thankful that you come in and give us wisdom. I also want to end and add that please stay connected to people. You know, now if you can't go out, people are having their parties, their birthdays and stuff on Zoom, you
Yeah.
know. So do Zoom activities, connect with people on Zoom. You can, those who have FaceTime, iPhones, and WhatsApp, you can face call, you can text. Let's check on people. Let's check on people. Let's check on people. It's so important. Last 2 weeks we checked on somebody who was very sick, and we had to do what we had to do. So please, let's check on people. Sometimes just your voice, somebody hearing your voice will rekindle their life. So this is where our act of kindness is very important. you know we pray, and then we do live a life of kindness. We all need that kindness. We are all living one life, and so this one life that we live in, make sure that you become a beacon of light in this pandemic that we are in. If you cannot do anything for anyone, be a beacon of light for your home, for your family, for your children, for your community, for the people that you are communicating on social media. Use your platform to promote positiveness, because it alone is also another form of medicine. It helps our mental health. Eat well, sleep well, try and cut off from the watch good movies, but don't binge, don't sit up all night watching movies, and try as much as possible to stay in a pattern so that your mental well-being is intact, because it is very, very, very important. I want to say a big thank you again to my guests, to Abby, to Ferdinand, to Daniela, to everybody who tune in, who also did contribute. We are Daniela is saying, Anna, please check on me. I hear you. Last week you were on to share. So thank you so much. And let's keep the lights going. Let's pray for each other. Pray for your leaders, pray for your bosses, pray for your managers, pray for the country, because this is a global thing. Pray for the country that you are in, because if somebody is traveling from another country and according to our health people have the new variant and they come into your country, it's a whole new ball game again. So let's pray for our countries. Everywhere you find, you pray for your neighborhood. If you sometimes go and knock on your neighbor's door, social distance, to check on them, to see. My next door neighbor had COVID, and because then one day we said we haven't seen this guy for a long time, so we knocked and then stood as he said, we just check in, and he said, oh, I've been here for like weeks. I've been very sick, so you never know. And we here in England, we know people might be dead in their house and you will never know for a long time. So it is important that
Mm.
we all check on each other and let's stay safe. Wear your masks, wash your hands, sanitize, social distance, stay at home, and also make sure that when they knock on your door, that come have your vaccine, or do your research. Do your research, and then oh, can you imagine? Okay, we were closing, but let's give this gentleman the last say because
Ferdinand
okay,
speaking.
you have 5 minutes to say something to us, my dear Ferdinand.
Amazing, amazing.
You
Thank you
made
very
it.
much for the
Okay.
opportunity. I mean, I was just lying down here and I thought, let me just go on Facebook to see what's happening. And I'm happy to chant into your program. Now, I think I would like to applaud you and your my follow. Ghanaians who are doing so well. Richard, Amissah, and Kwame Osei, Owusu. You guys are doing brilliantly. I mean,
Thank
yes,
you very
we are
much.
in the pandemic, and I think what I've heard so far, brilliantly. I mean, you've hitting the hammer on the nail. So I just want to just to say a few things. That one, yes, we are in a pandemic, and we shouldn't take it lightly. And as I said earlier, that I personally suffered it when it first started in March, and I was at home for about 3 months. I thought I was just going. I mean, you can't put it into words. You can't put it into words. But so let's be careful as we go about doing our things. When they say lockdown, let's lock ourselves down. Let's put on masks. Let's wash our hands. If we have to work at home, whatever we have to do, and the children, please. I think one of the guys said that the children mental health, it is very important. Let's check on them. Kids will be at home, they are bored, they'll be in their bedroom, they think they are sleeping. You think they are sleeping, but they are not sleeping, they'll be flipping on the phone. So let's once in a while, let's step into their room, check how they are doing. Let watch how they are doing their assignment is, the online training is education. Let's try to encourage them that this is not the end of life. There's more to life than what we're saying. Whatever it is, COVID will still go away. And I thank God that some of us, we are still breathing. Many have died. I work in, I mean, all of us are health professionals. So I see death almost every day. But of course, it is not something that we can put a blind eye to. Let's encourage one another. Let's motivate. Let's hold together. Call somebody. If you can't hear about somebody, call them. It doesn't matter whether they will pick up your call or not. Just if you are led to call someone, pick your call. Like I just called and said hello to my sister, and then she asked me to come online. So this is it. You don't know how somebody is faring. Take a phone them, check up on them. Don't try to isolate yourself, because the COVID itself has come to isolate us from society, to put us in a back corner whereby people will be bruising. A lot of people are hanging themselves. I've learned about a lot of people who have taken suicidal thoughts. Please, please, please. If it's prayer, let's pray. If the Bible, let's read the Bible. Let's encourage. The Bible says, he that encourages his brother encourages himself. So let's encourage each other in the Lord. And those of us who are in the work and health sector, let's obey the rules and regulations, social distances, washing of your hands, drink water, eat well, rest well, and make sure that you stay mentally alert, because
Hey,
this is not the end of it. There's a light
wow.
behind the tunnel. So
Thank
sorry,
you
I came late.
so much.
I don't want to
Thank
be
you
the person
so
having the
much.
last word.
Thank you so much. Thank you so much. I mean, just a few minutes, you really hammered everything and you've summarized everything for us. So I am so grateful. That's all when you love what you do, you're always prepared. We can call you
Absolutely,
1 minute and
absolutely,
then you can come
absolutely.
and deliver.
Yes, it's
So
true.
I appreciate. So I also want to end with this um, the organizations, because it is very, very important that you find yourself a good place, you find yourself the good professional, the organizations that are really out there helping. And also, if you know, in the Ghanaian community, any person that it's going through something and we need to know, so that we can point them to the right people, let us also do so, because we are here to look out for each other. So again, the Samaritans, when you Google, you find them, the Samaritans, Mind, Calm, National Domestic Abuse Helpline, Hope Up, and Every Mind Matters. Thank you so much. And I wish you the best. Have a fruitful week. And God bless you, gentlemen.
Thank
Thank
you,
Thank
you.
man.
you,
Thank you.
thank
Thank
you,
you.
Bye
thank
bye.
you.
Bye
Bye.
bye. Bye bye.
Bye.
Bye bye. Bye bye. So, to all of you who contributed again, thank you. Have a wonderful evening, a blessed week, and stay safe. Bye bye.